are different times with MMERI Forum Radio. I am Angela Hardman, Public Affairs for the Medical Marijuana Education and Research Initiative, where we discuss marijuana for medical use and the impact of the unlawful use of marijuana. Again, different times, different formats with my fabulous co-host.
Thank you so much, Angela. I'm Carol Angela Davis. Thanks so much for joining us this week and every week.
Yes, yes, yes. So we are relentlessly, we're relentlessly moving forward. We have a wonderful, wonderful guest today who took time out of his schedule. Dr. Newton, these are different times. This is a lot different from when we engaged you a few weeks ago, but I'm going to go ahead because we know you, I'm going to introduce you to our listening audience so that they know the expert that we brought on today to talk about marijuana for medical use and how it intersects obviously with COVID-19. But so that our listening audience knows that Dr. Terrell Newton is the Executive Director and Interventional Pain Consultant and Anesthesiologist with Acute Injury Relief. He is got his Doctor of Medicine in 2006 from the University of North Carolina School of Medicine, Go Tar Heels. He's licensed in both the state of Florida and North Carolina, has a litany of professional activities, including the Florida Society of Interventional Pain Physicians, the Florida Medical Association, and the American Society of Addiction Medicine. This is very, very prevalent to this conversation. And I have to say, you know, he's a doctor, but he's very, very much engaged in the community as we are. He's done over 20 medical cannabis dispensary and cannabis farm tours in Florida. He's a regular television and social media personality, talking about the alternatives to opioids for injury and pain treatment, non-surgical interventions for pain control, etc. He does awareness and educational events for acute injuries, acute and chronic pain, non-opioid treatments, non-surgical treatments, and plant-based CBD hemp medical cannabis. We are so thrilled, Dr. Newton, that you would take the time to engage with us today and give some, enlighten our listening audience on what's going on right now.
I would like to start by thanking you and thanking MMERI Forum Radio for allowing me to come and present my perspective and the experiences that I've had, some of my colleagues and some of our patients. I feel, in a sense, this is a public service announcement. Although I'm not giving any medical advice, I think from learning what we've been through as physicians, it educates my colleagues, but it also educates the general public who might also be current cannabis patients or maybe considering that in the near future.
And it comes at such an interesting time because of this COVID-19. I mean, it is just astounding what we're going through as Floridians, as Americans, and what is the crisscross there, Dr. Newton, if you will, between COVID-19 and medical marijuana, your practice as a cannabis physician, somebody esteemed, gone through one of the top medical schools in the country. Tell us a little bit about that.
Well, this has been interesting because COVID-19 has affected every industry. Obviously the medical field, but even more specifically, medical cannabis patients. Every day we're getting questions from our patients such as, is it safe to consume my medication? Is it okay to vape it? Is it okay to smoke? Other routes and they're asking, are dispensaries taking measures to prevent their employees from infecting products? But then we have patients getting deliveries. They're concerned that the delivery person may be transmitting the virus or maybe on some of the products that they're getting in the packaging. So we're getting tremendous amounts of questions and thinking of all aspects and ways that we can protect our patients. So from the time that an order goes in for a new patient, we just start the education process right away, just the general education on preventing COVID-19 spread in a general respect. So that's things like isolating at home, frequent hand washing, but then things that are specific to cannabis patients. For example, if you have a patient that was consuming for, let's say, recreational, which is illegal in Florida, but if they're sharing a vapor pen or if they're sharing a blunt.
Mm-hmm.
COVID-19 can be passed from one person to another.
Wow. Wow.
And with this being predominantly a lung disease, that puts someone at high risk, not only because now they're smoking, that can damage the lungs to a degree, but now they have this viral infection in their lungs. And so when you look at the spectrum of symptoms, which can range from asymptomatic to a mild pneumonia to severe pneumonia, to where the patient has to go on a ventilator, smoking can reduce some of the lungs' capacity to help the patient continue to breathe when they have a pneumonia. And so that combined with the virus can make a patient become vent dependent.
Sure. Dr. Newton, would you suggest at this point, in one of your patients or any patient that is using medical cannabis for treatment, would you suggest other forms at this point? And what forms would they be? Because I know vaping is that still a concern? The vaping?
Right, so the majority of my patients get a balanced approach. So when I put in an order, they may have a preference toward vaping or smoking, but in general, I tell them to take a balanced approach. So also take some medicine under the tongue, which is sublingual, or take it in a capsule or edible form, oral form.
Mm-hmm. Mm-hmm.
I recently had a patient, she's a CPA. And so because of the closing businesses and the demand for emergency loans, she's had a high amount of demand in her job. And so although she has PTSD, now her anxiety is worse. So she's wanting to take more cannabis. So the first thing she asked was, can I vape more cannabis because my anxiety is getting worse? And so I said, well, before you do that, let's think about it for a second. Smoking and vaping does put your lungs at some risk. So let's start with just adding an increase in your tincture, or start with a capsule. And if that's not helping, then go to the vape as the second or third thing as a backup. Because if you get the respiratory illness and you have a mild inflammation from smoking and vaping, that's just going to put you at higher risk from being dependent on the ventilator if you have a pneumonia.
Well, that's something you don't really think about when you're out here, going about your day and taking your medicine however you take it. I never certainly ever thought about the fact that, sharing vapes and sharing other things, probably sharing drinks, cups, if you will. It's really interesting. So we really thank you for letting us know.
Anyway, because you should be social distancing. So
hello.
The other aspect of it. Who are you sharing it with?
Thank you. And if y'all are all at home sharing stuff, you better stop. I'll tell you that.
And it better not be more than 10 people in the session. So you can't. 1040 coming up. But one thing I wanted to also mention is the surface. So like if you look at a vape pen and think of the surface of the pen, like the metal, the virus can last longer on a metal than it can on a plastic or cardboard. So like the physical properties of cardboard are similar to paper, where the virus would dry out in a few hours, it'll be essentially dead on the surface the next day. But with metal, because metal does not absorb any water and doesn't dry the virus out, the virus can survive sometimes 2 weeks on a metal surface. And
that's just fascinating, because metal is not even porous. So you would think, you know what I mean?
Mm-hmm.
In general senses, that wouldn't be the case, but.
Even a doorknob or the handle at a gas station, those different surfaces, can hold the virus for longer periods of time.
Wow.
Dr. Newton, I'm just wondering, what keeps you up at night about this virus? What is it that just keeps you up?
Well, there's so many aspects of it, but with my background in anesthesia, I just think about my colleagues and the difficulty they've had with patients on ventilators, to a point where they're actually running out of ventilators. There is a way to use an anesthesia machine as a ICU ventilator, to repurpose it. And not only that, some of my colleagues have actually had to put more than one patient on a ventilator, as many as 4 patients to one ventilator. And, as far as, my own patients, thank God I haven't had any. We've had some patients with a mild pneumonia, but none that have gone vent dependent. But that's the thing that keeps me up at night the most, is that those patients in ICU, they may not have the life-saving measures that they need to survive.
And
I was going to say, if we're able to, take hold, like self-isolate and be disciplined right now, we want to prevent the situation that they're having in New York. We want to prevent the situation that they're having, that they're going to have in Miami and in Los Angeles, these larger cities, where there's actually even medical personnel at risk because now they've run out of protective equipment. So now medical personnel affected, now you have less providers to service the patients.
Wow. And I know you talked about, and we're going to go to break shortly, so we may or may not want to get into this right now, but the anxiety piece of it. I mean, clearly folks are getting more and more anxious, and anxiety and PTSD are both qualifying conditions for medical cannabis. And we have a stay-at-home order, so there's also a telemedicine component that we got to talk about, because I know there were challenges before this thing. Hopefully some of that has absolved itself, and I know you'll get into that later, but.
Yeah, anxiety, even before COVID-19, anxiety is one of the most prevalent disorders that there is. So, if you look at PTSD and anxiety conditions, they affect about 20% of the population. Out of that 20%, about a third actually seek treatment.
Wow.
Certain groups that are at higher risk. So you have like first responders, now with the COVID, you also have healthcare professionals. And then anyone that's been affected financially, anybody that knows someone, they don't even have to directly experience the trauma themselves. If they know someone else experiencing it, that also leads to increased anxiety and post-traumatic stress disorder. So, the qualifying condition for Florida, PTSD and any related disorders, that's going to be more prevalent. But out of those people that are dealing with that, how many are going to be able to afford it? We've seen the dramatic climb, and the unemployment rate is approaching 7 million in the United States. It's just staggering.
Astounding. It is astounding.
Yeah.
A lot of people are saying that's why we got to do something about the healthcare. But that we've got your health on our minds all the time, and that's why we bring you such esteemed guests, such as Dr. Terrell Newton, and he's going to tell you how to get in touch with him as soon as we take this break. We want to tell you real quick. You can find us on the radio as well as on the iHeart podcasting platform. And on that radio, the counties are Hillsborough, Polk, Lee, Pasco, Pinellas, Bradenton, Sarasota, Leon, Gadsden, Volusia, Jefferson, Wakulla, and Duval County. And of course, go right to the website, mary.famu.edu, and you'll have a list of all the stations. Is that right, Angela? All the stations? We got them all on there.
Oh, we have them all. We have them all. Yes.
All right, we'll be right back. Thanks for watching. Stay with us.
Florida A&M University's Medical Marijuana Education and Research Initiative, or MMERI, wants you to know we take your health seriously. That's why we bring you our neighborhood forums and our weekly MMERI Forum radio program. During this coronavirus outbreak, remember to wash your hands often, clean and disinfect frequently used objects, and stay at home whenever possible. During this time of social distancing, the MMERI will remain a resource. Visit our website, mmeri.famu.edu, to watch our forum videos, listen to our podcasts, and find air times for our weekly radio show. MMERI, educating Floridians and minority communities about marijuana for medical use and the impact of the unlawful use of marijuana. Thank you for tuning in and staying with us with MMERI Forum Radio. We are here with Dr. Terrell Newton with Acute Injury Relief. Dr. Newton, before we went to break, we were talking about something that's alarming. I mean, we're in a space where we're all alarmed anyway, but we were talking about the anxiety, the increased levels of anxiety. And really what that can really perpetuate, which scares us all, is the unlawful side.
Right. Well, where it all starts is pain. Pain is an unpleasant sensory and emotional experience. So when you have that emotional pain that's being experienced, that's one of the things that can push people to addiction, because they want to escape their current situation, whether they're dealing with the physical pain or the emotional pain, and that can lead to drug abuse. So what we want to make sure that we're doing is educating patients. Okay, we have the dispensaries, the medication there, it's safe, it's tested. The dispensaries have policies and procedures in place to prevent the employees from having the virus. And so that prevents it from getting on the packaging and then the cascade where it gets to the patient. Mm-hmm. Believe it or not, roughly it's estimated for every one person affected with COVID, they transmit it to 3 people. And so that's what we're trying to interrupt. So that first person give it to 3 people. So now you have 3 new people, and then they give it to 3 new people. So now that's 9 new patients. And then they give it to 3. So that's 27 more. And then they give it to 3. So now that's 81 more. And that can happen in a short period of time, over a few days.
And so the sharing of
the registered dispensaries that are taking the precautions, you're actually increasing your safety. But but we have this battling thing. Okay, now it's expensive. I can't afford it, but I want to treat my anxiety. I want to treat my PTSD. So patients in the population now is in between a rock and a hard place. I don't have the money to pay for it legally, but it's even worse if you obtain it illegally, because now you're at risk of not just having the virus, you put yourself at legal risk, you put yourself at medical risk. And so that's by far worse. So hopefully the businesses that are in place can take advantage of some of these, programs and subsidies to where they can continue providing their paychecks and keep, patients used to that income that they're having on a regular basis. But that stress and anxiety, you have to recognize that, and you have to treat it. And if you can, prevent it. So take the time to occasionally meditate. Take the time to talk with someone about what you're experiencing. Don't hold everything inside. There's other people going through what you're experiencing. And not only can you help them by telling them your story so they don't feel alone, but then if you listen to what they have to say, that's a release too. And that brings the anxiety to lower and lower levels. And, use those resources, use your friends, use your family, write out how you're feeling, think about it, plan meditation, plan scheduled meditation if you have to, even if it's only 3 or 4 minutes a couple times a day, it makes a huge difference, all these measures.
Well, I mean, it goes back to the whole notion of what we do. There's safety in the multitude of counsel, which is why we do what we do, with community engagement and communications on this very serious topic, Carol.
Yes, it is. And it's really interesting because, some people have never meditated, and I'm just curious, you mentioned that, take the time to meditate. And I'm just wondering.
Yeah. I promise you, I did 30 minutes ago.
I believe, I know you are.
And I have an app, it's called Headspace. It's amazing.
Oh, that's a good one. Because I was going to ask you, Dr. Newton, I mean, if you've never meditated, okay, what do you want people to be thinking about? What do you want them to do?
Right. So when you look at, I group meditation, I also call it mindfulness. So meditation and mindfulness is being aware of the present moment. So it's not focusing on things that have gone into the past. It's not focused on past events, because that's going to make you depressed. It's not focusing on future events, because that's going to make you anxious. It's taking the awareness of where you are right now and relaxing and meditating. So if you want to get in a comfortable position, that's what I would start with. So laying down, imagining, picturing your body, your mind, your brain, your central nervous system, and absorbing all that energy into your spinal cord and brain. And that will relax your muscles. And then put your mind in whatever space you want to be. You might have noticed this pillow behind me says, "This is my happy place." So you want to put yourself in that happy place. You want to visualize those experiences that you had that have been very positive. You want to visualize those future experiences that you're going to have that are very positive. And think of a place of safety, whether that's, you're out at the beach, you're, walking with your girlfriend or your wife or your significant other. When you put yourself in that mental state and you're not focusing on the past or the future, that is mindfulness. It's being aware of the present moment and allowing yourself to be at peace.
Very interesting. I know, Angela, you talked a lot about one of your interests in telehealth.
Yes. Well, telehealth, and especially now, I wanted Dr. Newton to speak on that, because I know prior to this whole pandemic, there were cannabis doctors couldn't provide telemedicine because you have to see patients. Has that changed at all, Dr. Newton? Has there been any flexibility now?
Yes, here in Florida, this actually is a emergency executive order that started on March 16th. And so it's a 30-day order that allowed renewals of medical cannabis and also allowed renewal of prescription medications, so such as morphine, oxycodone, Percocet, to be renewed by follow-up through an audio-visual connection that's secured. So that's telemedicine. So traditionally, telemedicine is the audio-visual connection with the provider, and telehealth is kind of expanded. So that includes like your pharmacist, your nurse, and the other support staff that may be connected with the physician's ordered plans of care. So for right now, it's active for 30 days starting on March 16th. And I imagine that will be renewed, because in Florida, we're looking at, for the month of April, recommending that non-essential workers be isolated for the time being to prevent the increase in the spread of the virus.
And so that we're clear, so does that include for cannabis treatment as well?
It includes renewals, but
Renewals.
initial face-to-face has to be there to establish the relationship with the patient.
Okay.
Pre-established relationship, then you can do the renewals up until mid-April. But I would imagine that'll be renewed because we still have the isolation order in place until mid-April.
Let me just real quick, Carol. And so if there was a new patient, and I know you're having to be very careful and screen folks because you want to deal with, urgent care at this point, not necessarily. With the level of PTSD and anxiety, though, would you consider seeing someone face to face?
Yes, we're still seeing new patients. What we're doing is we're getting most of the information before the patient comes into the office. And so, we have all the information. We spoke to the patient and actually pre-qualified them.
Okay.
The majority of our patients are fairly savvy with email and everything. They can send us the paperwork ahead of time. So we have everything when they arrive. We've already talked about everything. So, we're just, getting maybe one or two other items, their signatures and a physical exam. So it's still a pretty easy process.
Okay.
So they're only in the office really just a few minutes to finish data collection and do a physical exam.
I'm curious, you're an anesthesiologist. And so whenever I think of an anesthesiologist, I always think of the person who's going to come before me and lean down on me and put me to sleep before my surgery. So I don't necessarily think of cannabis, although it can be mind numbing as well. But the question that I have is, could you tell our audience what makes you a cannabis doctor? What makes an anesthesiologist a really important part of the cannabis treatment continuum?
Well, so my core training is in anesthesiology. So after I finished medical school, I did 4 years of training for anesthesia. And then after that was completed, I did an interventional pain fellowship in Vermont. And in Vermont, medical cannabis has been available since 2004. And so there, you can give a certification where the patient can grow the medicine or they can get their medicine from a dispensary. They can't do both, but in Vermont, they can do one or the other. Since that time, they've passed, now they have adult use there in Vermont. So, my focus has always been injury, whether that's a physical injury. Also, I want to address emotional injury. That's why I have the additional training for addiction medicine. Because when injuries aren't addressed, whether that's physical or emotional, that can lead to drug abuse. So that's why I want to focus on preventing drug abuse. And with me being an anesthesiologist, I think that's just icing on the cake. So now I know a lot about lung health. I know a lot about ventilators, preventing patients from needing oxygen and becoming dependent on that. But other specialists that give recommendations for medical marijuana, they're good to see as well. So you might have a specialist that's a neurologist. And so then they can tell you about nerve pain and things like that as it relates to medical marijuana. We have another specialist that might be internal medicine. So they can, talk about, how do, blood pressure medications and how is blood pressure affected by cannabis. So I think it's good to have different specialties, but just depend on where you want to focus. My specific focus is on injury. But the anesthesia training that's just icing on the cake. And that's basically my first love is anesthesia, obviously the cannabis, and then interventional pain. So doing the procedures to help get patients pain control.
Well, when we engaged Dr. Newton on the panel in Jacksonville, we knew that passion, and because it's not just medicine for you. I mean, clearly, when we look at your resume and all of the engagements that you do, that you don't have to do, that really, really bodes well. And I hope our listening audience knows that they're getting it from, they're getting this information from someone who's not only, it's not an assembly line in your office, but someone who's, has a good
we definitely take our time with our patients. And one other thing I want to say about that is the schedules have changed completely, because last year, this time, I did about 12 to 18 events in the first 3 months. This year, obviously, so I started January and February speaking at several conferences. course, everything got shut down, and the conferences that were to take place this month and next month, now they're being moved to September and October. So it's impacted, you know, all aspects of medical cannabis, from the education of it at the conferences to how the dispensaries, you know, screen their patients, because now there's another component to it about COVID exposures, and the policies and procedures of the medical offices that do the certifications are changing, but also the dispensaries' policies and procedures are changing now. This has been, you know, a wide range of impact that, you know, no one could have really seen coming. I felt a recession was coming for some reason. I don't know why, but I expect this will be the cause of it.
You know, I think for all of us, we're like, well, there could be a recession, but COVID-19, we didn't see that one coming.
Yeah.
But we're glad we saw you coming, because we're so happy to have you on the show. Now, did you tell everybody? I know people are probably dying to get in touch with you. How do they reach you?
All right. One of the best ways to reach us is through our website, acuteinjuryrelief.com. I can also be reached through our office phone number, 904-374-0353. My email direct to my line is Dr. Terrell Newton, DRTRELNEWTON@gmail.com.
Can I just say this? Because Angela, you remember how we really got in touch with Dr. Newton. He is so on top of his game.
He's so on top of it.
Remember, that's why, so ladies, don't send any marriage proposals to this man. Okay, I already got that covered. So you just leave him alone.
Now she's matchmaking.
That's what we do. Hey, this man, listen, this man is so smart, and I'm so proud to have him on Mary Form Radio.
Absolutely. And can I impart one thing, Carol? It's so funny because he reached out, I think, the first, before we really got started.
Yeah.
And then I called Dr. Newton, and I was so surprised because I just knew I was going to get a receptionist. So I was taken aback when I said, is this Dr. Newton? He was like, yeah, this is Dr. Newton. And so we talked, and he had a scheduling conflict, and we were able to put it together. And at first he thought he couldn't be there. And I said, well, you know, we're doing this all the time. I said, you know, we can always engage you later. Is there someone else that you would recommend? He was like, oh, no. There's somebody else.
And there's no one else I can recommend either. Okay? I'll be dealing with that after the show. Now, Dr. Newton, thank you so much for caring. Thank you for caring about the community, about medical marijuana, about the patients that you have. And I know that Angela's going to close this show out, and so I'm going to be quiet, which is very hard for me, as you guys know. But we're going to close out the show and thank Dr. Newton. I hope you get in touch with him, because he's obviously very learned on the subject matter.
Absolutely. Absolutely. We will have that information available to our listening audience. Yes, thank you. Know that we will continue to engage you during the social distancing process. We have tremendous digital assets. Go to our website at MMERI, that's MMERI.famu.edu. And we have it all there. There's also a schedule of the air times for our radio show, and we will be back with you again next week.
Thank you.